In this brief video, I'll discuss why it is necessary, wherever possible, to be treated by a specialist team if you or your loved one are suffering from pancreatic cancer. So let's just talk briefly about pancreatic cancer. It's a leading cause of cancer death worldwide. Only 1 in 5 patients will receive life-saving surgery and other specialist care. Diagnosis and treatment of pancreatic cancer requires a very high level of skill and experience to get consistently good outcomes. A group of professionals who come together to work as a team, what value does that add? Let's look into that now. What professionals make up a specialist team looking after patients with pancreatic cancer? That includes surgeons, including their extended teams, anesthetists, those in theatre and those who work on the wards, radiologists, including interventional radiologists, gastroenterologists and endoscopists who may perform all the specialist procedures, oncologists, i.e. cancer specialists, specialist nursing who serve as a focal point for patients, provide patient information, oversight and liaison, histopathologists and pathology experts who view all of the biopsies as well as the material removed from cancer patients, nutrition and dietetic specialists, and those who have expertise in palliative care. So this is a basic framework of a team equipped to look after patients with pancreatic cancer. So how does this team work together? These teams are brought together at centers which have a specialist interest in treating patients with pancreatic cancer, the so-called high volume centers, where other smaller hospitals or units may refer into these centers, where all of these specialists can integrate and work as a team. Each member thus achieves a very high level of skill and experience level. Each member knows their role and how they integrate with other members, and each member is aware of the patient pathway and journey, and hence they offer organized and joined up care, thus minimizing delays. If several specialists come together, i.e. from different disciplines, then this is called a multidisciplinary team. And these teams hold regular meetings, and there's a prescribed quorum that I've described above in most centers. They discuss patient history, their x-ray findings, their endoscopy findings, pathology results and progress. They assess the treatment option in real time for each patient. If patients are already on the pathway and receiving treatment, then they would assess how the patients have responded to treatment and whether it needs to change. They thus minimize delays and minimize complication because all treatment and therapies are provided by experts. And then patients move to the appropriate specialist in a timely manner, and patients are assessed for trials and for future research opportunities. So in conclusion, wherever possible for you or your loved one, seek out and identify a reputable team that offers treatment for pancreatic cancer. Don't be afraid to ask questions, and you must ask questions about previous treatment results of the center and their outcomes, and you must ask questions around treatments that are not clear to you or you have doubts about. And it is always okay and your right to ask for a second opinion if you have any doubt or you wish to be absolutely certain about what is being proposed. I end this talk in the hope that this has been of some use to you. If you have any comments, please do feel free to share.